Okay, so today we're just demonstrating real-time ultrasound use. We've got a client here who's very happily agreed to be a guinea pig for this video. Thanks very much. He's been having some back problems, so we're looking at his core stability muscles. Integrated with that are pelvic floor as well. So really important, before we start progressing core strengthening, we need to make sure they're working properly and they're working on their own, not conjunction with all your other superficial abs. So what we're doing with the machine is actually putting the ultrasound head on the muscle that we want to look at and asking the patient to try to give us some of that contraction. So can you think about contracting those core muscles for me? Okay, good. So we can actually see those muscles tightening. What I want you to do this time is just relax and just lift a leg. Don't even think about your tummy muscles. Just lift either leg just fractionally off the bed. And what we see there is all these abs tightening without the core. So what we need to do with this person is start retraining those deeper core muscles to work before the superficial ones kick in. Okay, so we're looking at a muscle called transversus abdominis, which is one of the deep core stability muscles. Think of it as your corset muscle that protects the lower spine and the pelvis and is really integral with any strengthening of the core, hips, pelvis, even the lower limbs and trunk. So let's just move that mouse to where the muscle is. We see that it's bordered by those two white lines, so it's the black section within the two white lines. The arrow's on the bottom white line there, and they're what we call the fascial connections, or the outsides of the muscle where it joins into different layers of muscle. So what we're looking for is I'm going to ask the patient here to switch on his pelvic floor muscles, and we should see some widening through that black section of the muscle. Can you do that now for me? Excellent, there we go. And what we see is that's isolated, and we'll just move that cursor above, and we're not getting muscle contraction for the obliques above it, and just relax there. Excellent. Okay, so that's on, if we go up a little bit, we're on to internal oblique and then into external oblique, those two muscles there. Let's go again with that contraction. Keep your eye on that bottom muscle. Go again. Excellent. So we see a nice widening of that bottom muscle and the top two aren't moving. So we're getting isolation of the transversus abdominis. Now what we need to do with this patient is add in little things like leg lifts, arm lifts, movements of the body, and then that'll be training that muscle up nicely over the next few weeks. We'll probably spend 3 or 4 sessions doing this over the next 2 to 3 weeks. And then he's ready for some one-on-one Pilates using the reformers and other machines to kickstart his core stability program. And hopefully a lifelong pattern of better use of his lower back.